This is an absolute bloody nightmare. Hello and welcome, my name's Ed Hope, a junior doctor in the UK, and on this channel we break down the medicine in TV and film. Today we're going to be doing the South Korean TV hospital drama, Dr. Romantic.
우리 아버지가 먼저 왔잖아요. 여보, 저 사람이 나중이고 우리 아버지가 먼저라고.
This is definite medical negligence here. Highlighting that his dad was here before the other patient is kind of irrelevant because we prioritize people in the emergency department based on how sick they are at the front door, and I'm pretty sure they'd do that in South Korea as well. So the reason his dad should have been seen next is not because he was here before the other guy, it's because he's having a cardiac arrest, which makes him the sickest person in the hospital. And also he's complaining to the surgical team here, and his dad doesn't need surgery, he needs the cardiac arrest team, which doesn't have a surgeon on it. But he's every right to be angry. As I said, this is medical negligence. The cardiac arrest should have gone out and chest compressions and resuscitation should be happening.
사람 목숨 가지고 장난해. 병원이 의사가 그러면 안 되는 거다.
People being violent in hospital. Sad to report that this is pretty common. Just on my last shift yesterday, there was someone being violent. So I've had a phone thrown at me, I've been spat on, scratched, had a patient come for me and then security restrain them. It's not something that anyone should have to put up with, but it is part of the territory because when people come in, they might be under the influence of drugs and alcohol. They may have behavioural issues that may be intensified with being in a strange environment. You can have delirium, so the medical problem might bring out an aggressive side of them. And so because of this, we have lots of things in place to protect us. So security on hand, panic buttons, the doors are always away from the patient's bed so we can make an escape if need be, and also a good patient manner and being calm with the patient can help reduce this type of thing from happening. Okay, that was pretty cool, but yeah, we wouldn't be doing that. This dude isn't even a patient here, so we have no right doing any medical intervention on them. This is a matter for the police and security, so he needs to be restrained and arrested.
그들보다 나은 인간이 되거라. 분노 말고.
And so we see the kid has woken up in hospital. He should really be handcuffed to the bed here with a police officer with him for his violence, endangering the staff and for smashing up some of the gear. But it's an opportunity to have a talk with him about what's been going on. And this is one of the privileges and pleasures of being a doctor. You catch people at very important times in their lives. You know, although I don't remember everything I do at work, for a patient, they'll remember every single interaction I have with them. So it is important to listen to patients to understand what's going on in their lives. It's obviously had a big impact on him because he's become a doctor. Now, I wish it happened that quickly.
느낌 있으세요? 남의 살 같으세요? 야, 인턴! 네. 슈 인저리 같은데 서큘레이션은 괜찮은데 메디안 너브 눌린 것 같으니까 일단 패드 스플린트로 고정해주고 리스트 시리즈.
Okay, that was actually pretty realistic. When people first come in and we're escorting them to the trauma bay, we often get a very, very quick few line handover from the paramedic, which they've got here, and you get the full one when they're in the trauma bay. The doctor assesses the neurovascular states of the hand. I mean, we should just be making sure the patient is generally all right before we start looking at the hand, but either way, she concludes that the blood supply is okay. Obviously, it's an emergency if the blood supply to any part of the body is limited because we're going to get death of the tissue, but she does suspect a median nerve injury. So in the hand, the median nerve provides a sensation to the palmar aspect of the thumb, the first 2.5 fingers. And she requests an X-ray here, so she's probably looking at a fracture of the wrist, that the resulting deformity and swelling is compressing the median nerve at the wrist.
펄스가 거의 없는데. 함리티알 아테리 다이섹션인지 검사해야겠어요. 로우 익스트리미티 엔지오 찍어주세요.
Poplateal artery dissection. I'm laughing just because I managed to pick it out from the Korean. Actually, it's pretty serious. Poplateal artery is a big blood vessel that supplies your leg. You can actually feel the pulse in the back of your knee. Firstly, someone could die from blood loss if it is ruptured. And secondly, if it's not repaired, you can get tissue damage. And so you might even end up needing the leg amputated.
할 것 같은데 우리 엄마가 먼저 왔다고요. 우리 엄마도 많이 아프단 말이에요.
Okay, so echoing the intro to the show, he's got this moral dilemma now because he's been told that somebody was here before another patient. As we said earlier, that's irrelevant. It's who is the most sick at this point in time. And to be fair, she looks pretty sick.
전 응급 환자입니다. 만성 폐쇄성 폐질환 히스토리 있고요. 지금 썰스 상태인데 아무래도 뉴모니아 sepsis 의심됩니다.
환자 바이탈은 어떤데?
지금 100에 70.
He's doing exactly the right thing here. So highlighting with his senior his concerns about a patient. And this patient has COPD, so chronic obstructive pulmonary disease, a disease of the lungs that's generally from cigarette smoking. And we also hear that she has SIRS, so systemic inflammatory response syndrome, which is essentially a quick scoring method using the heart rate, the temperature, the respiratory and the white blood cells to figure out how hard the body is working against something. And in this context, we're talking about the body fighting an infection. So with the background of COPD, we'd be thinking a pneumonia, so an infection of the air sacs of the lung. And the worry is that this infection could make the patient septic, so where you start getting organ failure. You may still hear people use the term SIRS, but we actually retired it back in 2016 to focus more on the dysfunction of the organs rather than how your body responds to the infection.
폴리부터 끼워 지금 당장.
체스트랑 ABJ부터 체크해 주십시오.
이 환자 BP 떨어지는 거 안 보이니? 누가 더 급하니?
폐렴해야 폐를 찔지도 모른다고요.
Yeah, as we said, he's absolutely right to be concerned this patient may become septic. So that is where the inflammatory reaction that our body creates dilates our blood vessels and make them more leaky, dropping our blood pressure and starving our organs of blood supply. Although sepsis and blood poisoning, this is kind of a noob medical student thing to say. Those two words are not interchangeable. I think we were doing pretty well on the realism until this guy gets wheeled in and parked in the middle of the department like he's a refreshment trolley, and everyone looks around while they play kind of Game of Thrones music. Not realistic, terrible patient dignity, and neglecting the obvious medical emergency. I mean, that's his spleen gone. The paramedics have done absolutely the right thing here by leaving the foreign body in place and it only being removed in theatre because it's going to be helping to plug that bleeding.
업도멘 페네트레이팅 인저리라는데요.
연결해. 어떤 상황이야?
45세 남자고요. 1m쯤 되는 철근.
This is all pretty realistic here. The music being played in the operating theatre, the handover happening and the phone being held up to the ear of the surgeon. And you may also think, why is there not massive bleeding coming from this patient? But it does sometimes happen. People get lucky. And lots of great stuff going on here. They're getting the sterile gloves on and getting central access, putting the fluids up to treat that fast heart rate. Someone's holding the foreign body in place to stop it moving. I like that. Only thing that I would say is the person leading the trauma should be at the foot of the bed, coordinating everything so they can see what's going on, so they don't get sucked into one task and miss something else. Oh, that is serious. As much as there's a lot of things we can do for bleeding like this, say putting pressure on, packing the wound, medications to constrict the blood vessels, medications to help the blood clot, we can give more blood, so a blood transfusion. Ultimately though, that is going to be all in vain when it's this bad. We need someone to turn the tap off, and that's to get them into surgery.
윤 선생. 야 서정아!
제발 좀 담은.
This is an absolute bloody nightmare. Make no mistake here, this is absolute desperation. Even if she does manage to get the clamp on, the patient is still probably going to die.
여기다.
잡았냐?
잡았어요. 위치상으로 대동맥은 아닌 것 같고 비장동맥 같아요.
She's managed to stop the bleeding via the splenic artery. What did I say earlier? Spleen injury. Still got it.
환자 맥박이 점차 안정되고 있어, 선생님.
But come on, the vital signs would not improve that quickly. You'd actually worry that the heart had gone into some weird arrhythmia if it had changed that quickly. So this is nonsense, because you may have stopped the bleeding, but you haven't replaced the blood that's going to improve the vital signs. Because up to that point, that was pretty spot on. Yeah, and this is accurate. So riding to the operating room while holding a blood vessel. I've seen this type of thing before, not had to do it myself, thankfully.
야, 다 왔다 이제 다 왔다. 후, 하나, 둘.
Yeah, so it does happen. We sometimes have to remove things from different parts of the body, but you know what? I get asked about it way more times than you actually do it. And I'm kind of laughing about it now because this scene's played out quite comedy and got comedy music, but actually when it's happening, patients are absolutely humiliated and they're in a lot of distress, sometimes even pain as well. And you have to focus so you get the job done as best you can. So in reality, it's not really that funny.
쪽으로 그런 걸 히스테리성 인격 장애라 그러죠. 아닙니까?
그러는 너 같은 놈은 자기애성 인격장애라 그러지 아마. 9월 의식에 빠져 지가
So those are some real medical grade insults.
수고했다 인턴.
Well, I should have expected this, given the name of the show. So a bit of storeroom romance, and I have heard rumours that this type of thing happens, but it's always someone knew someone that knew someone. Yeah, you never actually know anyone that gets up to anything like this, but the world's a big place. It's probably happened somewhere. I did not expect that. They are ramming home the drama in this first episode. Although this is entirely realistic, I have ended up being part of the care of colleagues of mine because the people that work in the hospital also live around the hospital, and it's one of the toughest things in the job, particularly when they're very sick.
BP가 안 좋아. 오른쪽 머리를 부딪혔고 오른쪽 쇄골골절에 팔목 골절이니까 엑스레이부터 찍고.
Whoa, okay, so trauma like this, it's important not to miss fractures, but you have to start with the things that are much more serious. So we've got a head and possible neck injury here, and you also have to look for any signs of bleeding too. It's good that she's got a collar on here to keep her neck immobilized in case she has an unstable fracture, and that might sever the spinal cord, give her disability, it might even kill her as well. But the collar is not enough. She should also have the blocks on as well, and those blocks should be attached to the trolley she's on. Otherwise, you know, just the collar on its own is not a hell of a lot good. Surgeon as well, he was in the motor vehicle too. So someone needs to take control of this situation and get him away and to properly assess him. He's holding some ice on his head. So he is another patient that needs to be sorted out.
양은 많지 않지만 해모페리아.
Very good. So they do a bedside ultrasound scan, exactly what you should do, and they find haemoperitoneum, so blood in the abdominal cavity. That's not going to stop on its own, so she needs to go into theatre to have that explored where the bleeding's coming from, and so that can be stopped.
음주하셨습니까?
Oh, he's been Drinking, good spot. For a start, performing surgery on your loved one, not a good idea, but I'm guessing it has happened in some circumstances when you're the only surgeon on call, but it's going to be super, super rare. But Jesus, anyone that's done that. But this is a very different scenario. He's actually come in with her and he's been drinking. This would get you struck off as a doctor. There's going to be a surgeon on hand who's on call that should be able to sort this out.
머리 부딪힌 거 그 사람이라고.
We've done it again. This is exactly why you needed to assess this guy properly. Any blunt force trauma to the head is extremely dangerous, and no less dangerous with this mechanism of impact. So a car accident, lots of energy, lots of chance to damage structures, and this side impact of the head, we could be looking at an epidural hematoma. So a bleed around the brain inside the skull, and you might not have any symptoms from this initially, but as the blood starts to build up, it can then start compressing the brain, and that's when you're going to start getting symptoms. So you might be vomiting, you might become more drowsy, and then eventually as the brain becomes more squashed, you can lose consciousness, so slip into a coma, and then eventually it can kill you by forcing your brain out of the bottom of your skull, what we call herniation, and when that happens, it's almost always fatal. So this guy here needs an urgent CT head to look for any damage like that or any other damage too. I've just got this feeling that he's just going to find him unconscious in the corridor. Oh, okay. Thank goodness, he's okay for the time being. Oh. Here we go. The good thing is this has happened in a hospital, so he's got every chance of surviving this. We need to just put out that emergency call, get him a CT head, get the neurosurgeons there to put a hole in his head to reduce the pressure on his brain, and he should be all right, but he's by no means out the woods either. What? He stopped breathing, which... that's a pretty remarkable deterioration. This is either unrealistic or there's more going on than I talked about. Because if it's just the head injury, we'd expect him to progressively lose consciousness. Admittedly, this could be pretty rapid, but certainly not immediately stop breathing like we see here. However, it could be something much more simple going on and much easier to fix, because when you lose consciousness, you can lose the tone in your throat, so-called swallowing your tongue, and so you lose the ability to look after your own airway. Therefore, you just need to do simple airway maneuvers at the scene here to allow him to breathe. But I'm guessing because they're health professionals, they know that already, and he stopped breathing from some other way. And actually, we don't go on to find out in this episode what was wrong with Dr. Moon, other than it was fatal for him. So I'm guessing something like a traumatic brain injury and epidural bleed like we thought. And so there you have it, some superb scenes in that show. Some of the realism and some of the little touches they do were absolutely brilliant, and weaving it in with all that drama, I didn't know what to expect. And so if there's any other episodes of this you want me to check out, any other shows in general you'd like me to look at, then leave a comment down below. And if you've made it this far, you've no doubt enjoyed the video, so give it a thumbs up and subscribe if you haven't already, and you'll be notified when I put out similar videos in the future. Just leaves me to say, I hope you're all well. Thank you for all the support on the channel, and I'll be back real soon.